Have you ever noticed that climbing stairs, which once felt effortless, now leaves you winded or unsteady? You're not alone. After age 50, many people experience a decline in leg strength and mobility. But here's the good news: it doesn't have to be an unavoidable part of aging. Strong legs are the foundation for staying active, independent, and enjoying life to the fullest. If leg weakness is ignored, it can increase the risk of falls and limit daily activities. But by understanding the reasons behind weakening legs and making some key changes, it's absolutely possible to maintain strength and confidence for years to come. Let's go through the top reasons why leg strength declines after 50, and most importantly, what can be done about it. Age-related muscle loss, sarcopenia. As we age, one of the most common and often overlooked changes in the body is the gradual loss of muscle mass and strength, known as sarcopenia. While it can begin as early as our 30s, the effects typically become more noticeable after age 50 or 60. People often first notice it in small ways. Climbing stairs feels harder, lifting groceries becomes more tiring, or it takes longer to stand up from a chair. Over time, this decline in muscle mass can lead to weakness, slower movement, difficulty with balance, and an increased risk of falls. So, what's happening inside the body? As we get older, the number and size of our muscle fibers decrease, and the body becomes less efficient at repairing and building muscle. Hormonal changes, such as reduced levels of testosterone and growth hormone, also play a role. In addition, aging can affect the nervous system, which controls muscle contraction, making movements less coordinated and precise. But here's the encouraging part. Sarcopenia is not inevitable, and it's never too late to fight back. The most effective way to slow or even reverse age-related muscle loss is through regular strength training. This doesn't mean you need to lift heavy weights at the gym. Simple exercises like squats, using a chair, resistance band workouts, light dumbbell exercises, or even bodyweight movements such as wall push-ups can make a big difference. Incorporating protein-rich foods into your diet such as eggs, chicken, fish, beans, or dairy products can also help preserve muscle mass. Aim for small amounts of protein with every meal. Staying active in general, even through activities like walking, gardening, and/or dancing, keeps muscles engaged and helps maintain strength. Finally, regular checkups with your healthcare provider are important, as they can help identify early signs of muscle loss and offer personalized advice. Remember, while aging is unavoidable, losing your strength doesn't have to be. With the right lifestyle choices, you can stay strong, independent, and active well into your later years. Peripheral neuropathy, nerve damage in the legs. Peripheral neuropathy is a condition that affects the nerves outside the brain and spinal cord, especially in the legs and feet. As we age, this condition becomes more common and can have a big impact on daily life. It often develops slowly, and people may not realize they have it at first. One of the first signs is usually tingling or numbness in the feet or lower legs. Some people describe it as a pins and needles feeling, while others experience burning, sharp pain, or extreme sensitivity to touch. As the condition progresses, muscle weakness may develop, making it harder to walk, balance, or even feel where your feet are on the ground. This increases the risk of falls and injuries, which can be especially dangerous for older adults. There are many possible causes of peripheral neuropathy. One of the most common is diabetes, which can damage small blood vessels that supply the nerves. Other causes include vitamin deficiencies, such as B12, side effects of certain medications, alcohol use, infections, or underlying medical conditions like kidney disease. Sometimes no clear cause is found. This is called idiopathic neuropathy. The good news is that there are ways to manage peripheral neuropathy and improve quality of life. Managing the underlying cause is the first step, for example, keeping blood sugar levels under control if diabetes is involved. Regular exercise, especially activities that improve balance and strength, can help maintain mobility and reduce fall risk. Gentle stretching, walking, tai chi, or water exercises are often recommended. Medications may be used to help relieve nerve pain, such as certain antidepressants, anti-seizure drugs, or pain relievers. It's also important to take good care of the feet. Inspect them daily for cuts, blisters, or sores. Wear well-fitting shoes and avoid walking barefoot to prevent injuries. If you notice signs of numbness, tingling, or pain in your feet or legs, talk to your healthcare provider. Early detection can help prevent complications and keep you active and independent. With the right approach, many people with peripheral neuropathy can continue to live full, active lives. Peripheral artery disease, PAD. Peripheral artery disease, or PAD, is a common condition in older adults that affects blood flow to the legs and feet. It happens when the arteries that carry blood from the heart to the limbs become narrowed or blocked due to a buildup of fatty deposits known as plaque. As a result, the legs and feet may not get enough oxygen-rich blood, especially during physical activity. One of the most common symptoms of PAD is leg pain or cramping during walking, which usually improves with rest. This is called intermittent claudication. People may also experience leg numbness, weakness, or a feeling of heaviness. As the condition progresses, symptoms can worsen and even occur when at rest. In severe cases, PAD can lead to non-healing, wounds, skin color changes, or even tissue death, gangrene, which may require medical treatment or surgery. PAD shares many risk factors with heart disease, including smoking, diabetes, high blood pressure, high cholesterol, and obesity. It's also more common as people age, especially after age 60. Good news is that PAD can often be managed effectively with lifestyle changes and medical treatment. Quitting smoking is one of the most important steps, as tobacco greatly increases the risk of artery damage. Regular physical activity, such as walking programs supervised by a doctor, can improve blood flow and reduce symptoms. Eating a heart. Healthy diet low in saturated fats, maintaining a healthy weight, and managing conditions like diabetes and high blood pressure are also key. Medications may be prescribed to improve blood flow, lower cholesterol, or control blood pressure. In more severe cases, procedures such as angioplasty to open narrowed arteries or bypass surgery may be needed. If you experience leg pain, cramping, or wounds that are slow to heal, talk to your healthcare provider. Early diagnosis can help prevent serious complications and improve your ability to stay active and independent. With the right care and lifestyle changes, many people with PAD can enjoy a good quality of life. Vitamin D deficiency. Vitamin D deficiency is a common issue among older adults, especially those living in regions with limited sunlight or who spend most of their time indoors. Vitamin D plays a crucial role in keeping bones strong by helping the body absorb calcium. But its importance goes beyond bone health. It also supports muscle function, immune health, and balance, all of which are vital for staying active and independent as we age. When the body doesn't get enough vitamin D, bones can become thin, brittle, or misshapen, increasing the risk of fractures. For older adults, this can lead to conditions like osteomalacia, soft bones, or contribute to the development of osteoporosis, where bones become weak and break easily. Additionally, low vitamin D levels have been linked to muscle weakness, which can increase the risk of falls, a major health concern for seniors. There are several reasons why older adults are at higher risk of vitamin D deficiency. As we age, the skin becomes less efficient at producing vitamin D from sunlight. People may also spend less time outdoors or wear more clothing that covers the skin. Dietary intake can be limited, especially in those who have poor appetite or difficulty preparing nutritious meals. Certain health conditions, such as kidney or liver disease, can also affect how the body processes vitamin D. The good news is that vitamin D deficiency is usually easy to prevent and treat. Regular, safe sun exposure, just 10 to 30 minutes a few times a week on the arms and face, can help the body produce vitamin D naturally. Eating foods rich in vitamin D, such as fatty fish like salmon or mackerel, egg yolks, fortified dairy products, and some mushrooms, can also boost levels. For many older adults, doctors may recommend a vitamin D supplement, especially during the winter months or if blood tests show low levels. If you're concerned about vitamin D, talk with your healthcare provider. They can check your levels and recommend the right approach. Maintaining adequate vitamin D is a simple yet powerful way to protect bone health, improve muscle strength, and reduce the risk of falls and fractures, helping you stay active and independent longer. Sedentary lifestyle. A sedentary lifestyle characterized by prolonged periods of inactivity or minimal physical movement is a growing concern for older adults. As people age, they may experience a decrease in energy levels, health issues, or even a lack of motivation to stay active. However, staying physically active is essential to maintaining overall health and well-being as we get older. A sedentary lifestyle can lead to a range of health problems, particularly for seniors. Sitting for long periods of time without regular movement can contribute to weight gain, weakened muscles, and reduced flexibility. Over time, these effects can increase the risk of chronic conditions like heart disease, diabetes, and even mental health issues like depression and anxiety. In fact, research shows that older adults who are less active are more likely to experience a decline in their ability to perform daily tasks, which can affect their independence. One of the most significant risks of a sedentary lifestyle is its impact on bone health. Lack of weight-bearing exercise, like walking or light resistance training, can lead to weaker bones, putting individuals at a higher risk of osteoporosis and fractures. Physical activity also helps improve circulation and muscle strength, which supports balance and coordination. Key factors in preventing falls, a major concern for seniors. Luckily, it's never too late to become more active. Regular physical activity can improve overall health, boost energy levels, and enhance mood. You don't need intense workouts to see benefits. Simple activities such as walking, stretching, gardening, or even dancing can be very effective in improving fitness and preventing the negative effects of a sedentary lifestyle. Many experts recommend that older adults aim for at least 150 minutes of moderate aerobic activity, such as brisk walking, each week, along with strength training exercises twice a week. Starting slowly and gradually increasing the intensity or duration of physical activity can help prevent injury and build stamina over time. It's important to choose activities that are enjoyable and that match your physical abilities. Even small changes like standing up and moving around every hour or taking the stairs instead of the elevator can add up and significantly improve your health. By making physical activity a regular part of daily life, older adults can greatly enhance their mobility, strength, and mental well-being, helping them live more vibrant and independent lives. Osteoarthritis, joint wear and tear. Osteoarthritis, OA, is one of the most common joint conditions affecting older adults, and it is often referred to as a form of wear and tear arthritis. It occurs when the cartilage that cushions the joints breaks down over time, leading to pain, stiffness, and swelling. Cartilage is a smooth tissue that allows the bones in the joints to move freely, but as it deteriorates, bones can rub against each other, causing discomfort and limiting mobility. The most commonly affected joints in osteoarthritis are the knees, hips, hands, and spine. As the condition progresses, it can interfere with daily activities such as walking, climbing stairs, and even gripping objects. While osteoarthritis is often associated with aging, it can also be influenced by factors such as previous joint injuries, genetics, obesity, and overuse of joints due to repetitive activities. The symptoms of osteoarthritis can range from mild to severe. In the early stages, individuals may experience occasional discomfort or stiffness, but as the condition advances, the pain may become constant and more intense, especially after activity or in cold, damp weather. The joint may also become less flexible, making it harder to move through a full range of motion. In some cases, bone spurs may develop around the affected joint, which can further restrict movement. Though there is no cure for osteoarthritis, there are several strategies to manage symptoms and improve quality of life. Lifestyle changes, such as maintaining a healthy weight, are crucial for reducing strain on the affected joints, especially the knees and hips. Regular low-impact exercises like swimming, cycling, and walking can help strengthen the muscles around the joints, improving support and reducing pain. Stretching and flexibility exercises also play an essential role in maintaining joint mobility and reducing stiffness. In addition to exercise, joint protection strategies such as using assistive devices, e.g., canes, knee braces, and modifying home environments to reduce strain can be helpful. Medications, both over-the-counter and prescription, are often used to manage pain and inflammation. In severe cases, surgical options such as joint replacement may be considered to improve function and reduce pain. Although osteoarthritis is a chronic condition, with the right approach, individuals can manage its impact and continue to lead active and fulfilling lives. It's important to consult with a healthcare provider to create a tailored treatment plan that fits one's needs and abilities. Medication-induced muscle weakness. Medication-induced muscle weakness is a common issue among older adults who take medications for various chronic conditions. Certain medications, while effective in treating illnesses, can have side effects that affect muscle function, leading to weakness, fatigue, and sometimes muscle atrophy, muscle wasting. This condition can make it difficult for individuals to perform everyday tasks, such as walking, standing, or lifting objects, and can significantly reduce quality of life. Several types of medications are known to cause muscle weakness as a side effect. These include corticosteroids, commonly prescribed for inflammation-related conditions like arthritis or asthma, as well as certain blood pressure medications such as beta blockers, statins for high cholesterol, and medications used for osteoporosis like bisphosphonates. Some antidepressants, anti-seizure drugs, and chemotherapy medications can also contribute to muscle weakness. The exact mechanism behind this side effect varies depending on the medication, but it can involve changes in muscle metabolism, nerve function, or the ability of muscles to contract properly. Corticosteroids, for instance, can cause muscle weakness by reducing muscle protein synthesis and impairing the muscle's ability to recover after physical exertion. Statins, while effective at lowering cholesterol, can sometimes cause a condition called myopathy, which is characterized by muscle pain, weakness, and cramps. In some cases, muscle damage can be severe and require discontinuation of the medication. The risk of medication-induced muscle weakness increases with age, as older adults are more likely to take multiple medications and their bodies process drugs less efficiently. Additionally, the muscles of older adults may be more vulnerable to the effects of these medications due to age-related muscle loss, also known as sarcopenia. If muscle weakness is suspected to be related to medication, it's important to consult a healthcare provider. They can assess the situation and determine whether the medication needs to be adjusted or replaced with an alternative. In some cases, physical therapy or strength training exercises can help rebuild muscle strength and alleviate the symptoms of weakness. It's also important to maintain a balanced diet rich in protein, vitamins, and minerals to support muscle health. Ultimately, while medication-induced muscle weakness can be concerning, with proper management and medical guidance, its impact can be minimized, allowing individuals to maintain their independence and overall well-being. Osteoporosis and fractures. Osteoporosis is a condition characterized by weakened bones, which become fragile and more prone to fractures. It is especially common among older adults, particularly women after menopause, but it can affect both men and women as they age. The condition occurs when the body loses too much bone mass or doesn't make enough new bone tissue, leading to a decrease in bone density. As bones weaken, even minor falls or everyday activities like bending over can lead to painful fractures. Fractures due to osteoporosis often occur in areas like the spine, hips, and wrists. These fractures can result in significant pain, reduced mobility, and in some cases long-term disability. A broken hip, for example, can be life-changing, with recovery often requiring surgery and extended rehabilitation. In addition to the immediate physical consequences, Osteoporosis-related fractures can lead to emotional challenges, including depression and anxiety due to the loss of independence. The risk of developing osteoporosis increases with age, and several factors contribute to its development. These include a family history of osteoporosis, lack of calcium and vitamin D in the diet, sedentary lifestyle, excessive alcohol consumption, smoking, and long-term use of medications like corticosteroids. Hormonal changes, such as those that occur during menopause, can also accelerate bone loss in women. Preventing osteoporosis and fractures involves a combination of lifestyle changes and medical management. Ensuring adequate intake of calcium and vitamin D is essential for bone health. Weight-bearing exercises like walking, jogging, and strength training help to stimulate bone formation and maintain bone density. Medications such as bisphosphonates or hormone replacement therapy can also be prescribed to slow bone loss or promote bone formation in individuals at high risk for fractures. For those already diagnosed with osteoporosis, fall prevention strategies are crucial. This includes making the home environment safer by removing tripping hazards, using assistive devices like canes or walkers, and staying physically active to improve balance and strength. Regular bone density screenings can help monitor bone health and detect osteoporosis early, allowing for timely intervention to reduce fracture risk. In summary, osteoporosis is a significant concern for older adults due to the increased risk of fractures. With the right preventive measures and treatments, individuals can reduce the likelihood of fractures and maintain a higher quality of life as they age. Poor circulation from heart conditions. Poor circulation, often linked to heart conditions, is a common concern for older adults. When the heart is unable to pump blood efficiently, it can lead to reduced blood flow to the extremities, such as the legs, feet, and hands. This can result in various symptoms like cold or numb feet, swelling, muscle cramping, and in severe cases, even the development of ulcers or sores that are slow to heal. There are several heart-related conditions that can contribute to poor circulation. One of the most common is coronary artery disease, CARD, where the arteries that supply blood to the heart become narrowed or blocked by fatty deposits. This reduces the heart's ability to pump blood effectively, which in turn affects circulation throughout the body. Another condition, heart failure, occurs when the heart's ability to pump blood is significantly impaired, leading to fluid buildup in the lungs and other parts of the body, further impacting circulation. Peripheral artery disease, PAD, is another condition that can cause poor circulation. PAD occurs when the arteries in the legs become narrowed or blocked, limiting blood flow to the lower limbs. This can cause pain, cramping, and even tissue damage in the affected areas. People with PAD are also at an increased risk of developing more severe complications, such as gangrene or even limb amputation if left untreated. Poor circulation due to heart conditions can also result in symptoms like fatigue, dizziness, and shortness of breath, as the body is not receiving the oxygen and nutrients it needs to function properly. Over time, this can lead to a decline in overall health, making it more difficult for individuals to maintain their daily activities. Managing poor circulation caused by heart conditions involves addressing the underlying heart problem. Medications. To improve heart function, such as blood thinners, beta blockers, or ACE inhibitors, may be prescribed. Lifestyle changes, including a heart-healthy diet, regular exercise, and smoking cessation, can also improve circulation. In some cases, more invasive treatments like angioplasty, bypass surgery, or even heart surgery may be necessary to restore proper blood flow. Regular checkups with a healthcare provider are essential for those with heart conditions to monitor circulation and prevent complications. Early intervention and consistent management of heart health can help improve circulation, reduce symptoms, and enhance overall well-being. A balance and coordination decline. As we age, it is common for balance and coordination to decline. These vital skills are essential for everyday activities like walking, standing, and climbing stairs. When balance and coordination are compromised, the risk of falls increases, which can lead to serious injuries such as fractures or head trauma. This decline can be caused by various factors, often working together to affect an individual's ability to move and stay steady. One of the primary contributors to balance issues is a decrease in muscle strength. As people age, they naturally lose muscle mass and strength, a condition known as sarcopenia. Weakened muscles make it harder to maintain posture and support the body while moving, leading to instability. Additionally, loss of flexibility in the joints and ligaments can make it difficult to move fluidly, further affecting balance. Another factor is the decline in the sensory systems that help us maintain balance. The inner ear, which plays a key role in detecting head movements and position, may become less responsive with age. The sensory system in the feet and legs, which provides feedback about the surface we're walking on, may also weaken. When these systems don't function as well, the brain receives less information about body position, which can lead to difficulty coordinating movements and maintaining balance. Neurological conditions such as Parkinson's disease, stroke, or multiple sclerosis, MS, can also contribute to balance problems. These conditions affect the nervous system, impairing the communication between the brain and muscles necessary for coordinated movement. For example, Parkinson's disease causes tremors, stiffness, and slow movement, all of which can disrupt balance and coordination. Vision changes are another factor in balance issues. Poor eyesight can make it harder to judge distances, navigate obstacles, or maintain a steady posture. As people age, common conditions like cataracts or macular degeneration can reduce visual acuity, leading to a greater risk of falls. 2. Address balance and coordination decline. Engaging in balance exercises, strength training, thrusts, and flexibility activities can help improve muscle tone and coordination. Tai Chi, yoga, and simple balance exercises like standing on one leg can strengthen the muscles involved in balance and enhance proprioception, awareness of body position. Additionally, wearing proper footwear, getting regular eye exams, and creating a safe environment by removing trip hazards are essential steps to prevent falls and promote safety. By focusing on maintaining muscle strength, improving balance, and seeking medical attention for underlying conditions, older adults can minimize the impact of balance and coordination decline and maintain their independence and mobility. Maintaining mobility and independence as we age is vital for overall well-being. The factors we've discussed today, from muscle loss to balance decline, are common challenges, but they are not insurmountable. By incorporating regular exercise, paying attention to nutrition, and managing any health conditions, we can reduce the impact these issues have on our daily lives. Remember, taking small steps to care for your body can make a significant difference. Whether it's engaging in strength training, improving balance, or working with your healthcare provider to address underlying conditions, you have the power to enhance your quality of life. Don't wait to take action. Start making these changes today and give your body the support it needs to stay strong, active, and safe. You deserve to live a healthy, active life, no matter your age. Thank you for watching, and take care of yourself.